Providing an update on the health platform and the vaccination program in the province. Let's take you live to that briefing.
Thank you very much, Premier. We'll now hand over to the Minister of Health, Dr. Nomapinchambam.
Thank you, Kayla. Thank you, Premier. Yes, indeed, it is worrisome that we see the country as a whole, vaccine apathy or vaccine fatigue. I think as a country, we saw the best day where we had quite a large number of vaccines was around 26 July. And the worst days where we had a lowest uptake of the vaccines was the week of the 2nd. Whilst as a province, we try to make sure at least we go up to 200,000 vaccines per week. And I think by next week, we'll have about 180,000 as a target. And although we have been on the 120,000 target per week, at least we've seen the increase to even there was a time where we had even 168. But as I indicated that with the vaccine apathy that has happened in the country, it is worrisome, especially when the epidemiologists do warn us that there is a fourth wave that upcoming. And therefore, that's why for us as a health, we cannot sit. And also we are appealing to everyone, don't sit down and fold your arms. If you don't come to the vaccination site, noting that we have opened more vaccination sites in this province than in any other province, but it means that we have to come up with innovative ways to get to you. We have explored with a pop-up buses wherever you are, especially in the farm workers. We have been brought pop-up buses at the library where you'll be able to have an access, and also at the malls where you could have been in access. That's why we are saying we're up in arms for the jabs to make sure that everyone does have an access. That's why we are actually now going to the places and coming up with other areas of vaccination sites that are non-health. As Premier has indicated, we have opened the Athlon, which will be the first drive-through site for the province. But also we have to put some frills, especially when the AMA bundles, the over 18s, will be opening for them, where we could also bring some music truck in order for them to attract them. Because as we know, COVID or no COVID, with the young people, they don't like to go to mainstream kind of the health services. It's exciting that there will also be opening of the Forest Hill, which is a campus that has been used by the UCT, which won't be only accommodating for the students and the staff there, plus for everyone, especially we know that there's a high traffic in the main road and also around the ops for the young people they could be able to access. I'm excited that we will even open like the big hall. Okay. The big hall in Kailicha, like the Miwe or Tambo Hall, where also we could be able to make sure that we attract as many young people, because we don't want the white elephants. I'm not joking when I'm saying that I will go to the clubs, Long Street, and find you then bring the jabs if need be. For example, the Rans Club in the Kailicha, they even made an offer that probably when people come in, they must need to show that you have had a jabs, or even doing some jabs there, not talking about the alcohol. Even that we go out of our way, pushing more, thanks to the HOD from the Public Works and Transport and to where now they are negotiating to have additional transportation through the Red Dot taxi to be able to get as many, as you have already showcased how we have used the road debt for Ekolweni and Bito and also Volverefil for the people coming or going to vaccinate, for example, in Danun, and also in the southern suburbs, southern structures where we have used the red dot for all of those. Whilst we are excited that AMA bundles, it will be opening for them, but let's not forget, we still have got the vulnerable. And if the vulnerables, that we don't reach them, that they need to come for the vaccination, we mustn't only be excited about the numbers of improving the numbers, but when they are still out there, it means that these are the ones who are likely to clog the health system coming the fourth wave. So that's why we have to come up with many ways to not to forget them. Tomorrow, National Minister of Health is coming as part of his oversight, has been visiting provinces throughout. I'm taking him to the Premier to the Grand West, which is the first vaccination site that targets the hospitality industry. So it's not only for their staff, but all other outlets, workers that are there in that space of the Grand West. Not only that, they are even open for the communities adjacent, where we'll be bringing some of the factory workers around the Epping and some of them, so those people who might be working, for example, in other food outlets are outside the Epping, or even the hawkers that are outside, that will bring them. With the older persons, thank you, Overbeck, for being one of the people that have vaccinated the most of the over 60s, and similar with the Klepfontein. But thanks Garden Route for having more of the population that has been 100,000 population that has been vaccinated. Thank you very much. Whilst you still have got the challenges in Central Karoo, which I'm going to talk about it shortly right now, because they are managing that sub-district as well. The homeless, we've seen some clusters in the culture and also in the eastern substructures from the homeless. Similar also in the southern structure. But I'm excited that that program, where we push an envelope, it is working very well. City has assisted to vaccinating most of the others in the Payne City. Tomorrow, actually, the team will be vaccinating the elderly homeless who have been placed there in the Haven shelter. I think there will be about 100 plus who will be getting their second Pfizer. For them, they were given the Pfizer because anyway, they are the elderly homeless where they've been kept there. So I'm excited about that part of it. And also, there's also a question about men. Some of you might have received SMS coming from the National Department of Health about the men. Of course, men it is always the case in regard to the behavior. Men don't utilize the health services anyway, but also we need to take into consideration that for the over 60s, you find that because of the life expectancy, women live longer. You will expect to have more cases of women that are being vaccinated. But in the Western Cape, we don't have much the difference. It is a reflection on the life expectancy in regard to that space. So for the Central Karoo, the last one where we're going at, I'm excited. We're going to go to Lechamka and the Tervater, where we are bringing the music truck, thanks to the National Government Community Services, where we'll be calling for at least for probably next week, it will be open for the youngsters as well. So it's no longer about the AMA 50s upwards. And have you ever thought about the way you can even have a music truck in Merville? And it did work, by the way, in some of the areas where we have been able to work together with the GCI's community services in regard to attracting as many people. That's why even jokingly I said to the mayor, for the athlon, for the where they're also part, they own the stadium and other parts. We need to bring as many in order to attract all of those. I'm still concerned with the Matsikama. We've seen some of the clusters coming from the smaller towns that are coming there. In as much as that we have vaccinated as many, I think once we are open now for the AMA 18s and above, we will be able to vaccinate them. But you will see that some of the clusters are coming from the school. Now, Dr. Klute is going to do the presentation. You'll see in the presentation about how the Delta has affected the less than the under 18-year-olds in regard to the infections. And also, lastly, you'll see that in regard to our percentage of how far are we when it comes to we've reached the peak or not, you'll find that the percentage is still the same because we are still concerned about some of these clusters that are happening as a province. But in all other indicators, in the reproduction rate and all of those, and positivity rate, we have dropped. So going forward, guys, I appeal to you that vaccination does save lives. And the SAPRA has demonstrated that out of the cases that were presented to the South Africa, the death, they found zero. There was no link of the death with the vaccine that is happening. If anyone has got an evidence of a person who died from the vaccine, that person must bring that information forward. There is an app system that one can even make use of But if you don't have that evidence, we appeal to you, don't come up with a misinformation, because lives matter. And we don't want, us as healthcare workers, we haven't been to any holidays. Come December, we just need a break. But with you that you keep on spreading misinformation, you are putting things actually awkward for the healthcare workers. So you can choose to vaccinate, or you can choose to ventilate if you don't take the vaccination. Thank you. Over to Dr. Kruti for the presentation. Thank you, Kayla.
Thank you, Minister. We'll now hand over to Dr. Kruti for his weekly presentation.
Thank you very much, Kayla. Thank you for the Premier and the Minister for the introduction. Kayla, can you see the presentation?
Yes, it's perfect. Thank you.
Okay. So my presentation will cover the following aspects: the surveillance and response update, our expectations for the third wave that we're in, the triggered response, and then the vaccine update with a few concluding remarks. In terms of where we find ourselves on the trends of data, you can now see this is one graph capturing all our markers. The gray bars are the cases that's reported. The green is the use of oxygen, green line. The blue line is hospitalisation. The dotted red line is the excess death from the MRC, and I'll come back to that. The dark red line is the reported deaths that we have in our system. And then the yellow line, very important for us, is test positivity. As indicators, those markers are all pointing to a plateau and early signs of decline in the province. If you look at the reproduction number, it's a very important sensitive indicator. A reproduction number of 1 means we have equal number of active cases being created by the active cases. If it drops below 1, we start having fewer active cases by current active cases, and that's when we start seeing a drop in cases. We are at about 1, and obviously our aim is to keep it below 1 so that we can start the decline of cases over the coming weeks. This is the national trends. Just to update everyone, Gauteng has now dropped below the end of wave threshold for them, so they're officially exiting the third wave. Other provinces remain in the third wave, mostly decreasing or plateauing, but there are increases in Eastern Cape, KZN, and Free State. Those are the signs that is across all the provinces in the country. The provincial picture in the Western Cape is the following. And we're heartened that we are seeing the early signs of small percent decreases to some of our indicators. So the graph on top shows a 12% decrease week on week, full week on week, week before and the week before. Just to remind us that there was a public holiday in last week, so it has to be seen in the context of one public holiday in that week on week comparison. There's on the left bottom smear positivity, which is a very sensitive sign for us. That has now dropped to about 37%, and that normally is a very sensitive sign when you start coming off a peak of a wave. You also see that our hospitalisation is also 8% decrease week on week, and then the death 17% week on week. So we have an average of 2,800 new diagnoses a day, 320 new admissions a day, and the deaths have decreased now to around 100 deaths per day. If you take the metro specifically, there's an overall 10% decrease in the metro week on week. All sub-districts are seeing decreases, except in Khayelitsha, which has got small increases, but Khayelitsha is of such small numbers. It's not really comparable to the other areas. We go to rural, there's a similar pattern of decrease. It's about a 12% overall decrease week on week. And it also is uniformly across all the rural areas. Our active cases, very important, sensitive for us. This is the pool of cases available. It's still at about 46,000 active cases. That's 4,000 more than last week. And the risk of being exposed to COVID is still very high. So we're still very much telling people we are seeing the decline, early decline of the peak. It does not mean that there's not a lot of active cases around. So gatherings still pose a very, very high risk in the Western Cape because of these high number of active cases. These are our, we call it surveillance huddles, reflections. This is where all our teams get together and they reflect. So we just highlighted a few things. You will see that there's quite a few clusters. We've seen some cases related to schools. There is also lots of family clusters. And there's in Garden Route, there was a decrease in certain areas, but then an increase in other areas. Overberg, you see some family and farm clusters. And then West Coast, as Minister Mbombo said, a very interesting phenomenon in West Coast. They had a relatively mild first and second wave in certain of the very, very small remote towns. It is as if in the third wave, we've now seen each of those small towns had an upswing in the third wave in terms of significant numbers. And therefore, I'll show later that West Coast is actually one of the areas that's got a higher third wave than a second wave. This is a very important thing for us. So this is what we've been noticing on our graph. So we had to go and see why was there an actual surge in cases after the plateau that we reached. And the two graphs that we're showing here is the blue graph comes from the mobility data, from Google mobility data. And what you see in that blue graph is what we call residential mobility. Now, in the height of when people are less mobile, the residential mobility is the highest. So when people are not going out of home, that blue line is at the highest. We happen to have had that at the same time as the taxi violence in this in the metro specifically. So we had high levels of mobility at the residential level, therefore low movement elsewhere. When the taxi violence stopped, when we moved from level 4 to level 3, and when the schools opened altogether, the mobility at household residential level dropped. That means people were more mobile. They were going to schools, they were going out, they were going to other places. That is when we coincided with the increase in the daily cases going up. So all of those factors together resulted in almost like a secondary surge on top of our third wave that has prolonged our wave in this province. An interesting phenomenon that we've picked up there by analyzing the age groups, we then see that under 20, and that is the age group, if you just look at the colors on top there, the age group in that one, which is the yellow bar, is 15 to 19. There is a significantly higher increase, and it happens to be that we've opened the schools. It's the first time, because in the second and the first wave, the schools were both closed. This is we had at the peak, towards the peak, the schools opened, so we had more cases in that age group. And the blue line, which is 10 to 14. So for those children, and we compare the second and the third wave, and we can see there's a bigger proportion of children in that age group that have got infection. And it made up a higher proportion. And when we say admissions, it's a very small increase in admissions also that comes out of that. There's not been more severe cases. There's not been more severe illness for children. So it's merely just picking up cases. But the factors that influence that, we've also been doing more testing than we've done before. The schools were mostly open then in this wave. We're also vaccinating older groups. And then the Delta effect, because it's a high viral load before onset of symptoms and minor symptoms similar to cold and flu, it is responsible for this bigger surge of 10 to 14 and 15 to 19. But just to reiterate, in all of the schools, this is very carefully monitored and managed. And we're working very closely, our teams with the education department, to work very responsibly school by school in terms of the reported cases. And we're gladly seeing also a tailing off of those cases as we see the tailing off in the third wave. The excess death is a very sensitive marker to us. We can now see that the very clear sign that we've come off the excess death. It's normally a sign that you come off a peak is when your excess death start decreasing. We can now see that there's 23,000 excess deaths since May 2020. We track this very carefully, and our deaths in this province tracks very nicely and carefully, very closely to the reported excess deaths. So that is for the overall for the province and then for the city at the bottom. An interesting phenomenon is also to understand this excess death. So what we're doing here is that we're comparing the deaths that we've had here with the predicted number of cases in the wave. And it appears to us that we've now had fewer excess deaths in this wave, the third wave, compared to cases than in the preceding cases. And we're obviously analyzing that, but we are putting that down that at the peak, we've been able to maintain and give access to healthcare in hospital beds and oxygen. So that seems to be, but there's also the factor that potentially we are now starting to see early also the impact of vaccination in the older age group. So comparing our waves, that's the interesting phenomenon we're showing you right on top. The brown line is then this phenomenon that I just described to you now, is that our third peak, then cases are very similar to the second peak. But you have the interesting phenomenon that we had a plateau, and then we had a secondary surge on top of that plateau, which I explained, and now we're seeing the decline. If you look in the public sector, that bulk of that late incline was seen in people using the public sector. So on the bottom, it's the number, it's the cases on the left. In the middle is the admissions, and to the right is the deaths. So you can see the private sector peaked earlier and plateaued and came down earlier than the public sector in the province, both for cases, admissions, and for deaths. When we then look at it in geographic areas, we can see in certain areas there were higher waves in the third wave compared to the second wave. In the metro, it's specifically in places like Klipfontein and Mitchells Plain, and then also in Northern and in Tygerberg. If you go to the rural areas, it is mainly in Central Karoo and then Garden Route, and as explained in the West Coast, that we've seen this third wave that's higher than the second wave. The Medical Research Council, City of Cape Town, Brede Valley and Theewaterskloof monitoring system for wastewater has also shown that in the past week, we've seen a very high concentration of COVID in the wastewater in the metro and in the Dorens in Rawsonville. Tosefie and Worcester stayed the same. Botterrivier and Grabouw stayed the same, but Caledon and Beluisterop also has increased. What is our expectation for the third wave? So the South African COVID Modelling Consortium have now predicted lower cases for the last week. We had lower cases last week, so they're predicting lower cases for the next 2 weeks. We must be understanding that we had a public holiday in there where there was less testing. So adjusting for that, we are predicting less cases going forward. So their probability, very conservatively, I would say, remains at 34% that we've passed our peak. I think because they're waiting out to see if the effect of the public holiday is out by looking at the full week, which is this week, without a public holiday, then the probability for us passing our third wave will then obviously be higher next week. What has been our triggered third wave response? We've had this 4-tiered response, and we're still taking under significant pressure on the healthcare platform and being in that fourth area of concern with the markers that we've identified. So we have 3,600 hospitals still in hospital for COVID, just over 2,000 in public sector and 1,600 in the private sector. If you look at the intermediate care in Brackengate, we have 274 patients. And in Mitchells Plain Hospital, with 123 patients. Those two places are the release valve for our other hospitals in terms of COVID cases. Our mass fatality center, there's 34 bodies being processed in that place. Our public dashboard as of yesterday for the public sector operational beds, 91% full yesterday, 97% in the metro. The big marker that we look at here, though, is that the COVID capacity that we've created is now at 71% full. And the percentage of COVID patients in our hospital beds has now dropped below 30 to about 28%. If you look on the right-hand side, you can see critical care is still full at 99% of all our critical care capacity across the province. But you see that the bed occupancy in our general wards runs at about 70%. So there's a slight increase week on week. And obviously, as we come off the peak, this will start improving over the coming weeks. And just a reminder, we're just over 2,000, but we've made provision in the third wave to be able to accommodate up to 2,600, which we gladly have not had to go to in terms of the capacity we've created. Oxygen, we've also currently running at about 78 tons of oxygen per day. That's more than a production capacity. And in the last bullet, you can see 22 tons are still being brought into the province. But by and large, we've coped extremely well with oxygen, public and private sector, and there's been really no concerns of oxygen shortages through the entire third wave. Our trauma surveillance, we continue to look at the trauma, and you can see that with adjusted level 3, that in now we've got 3 weekends is now passed. The first weekend being quite high, second weekend lower, the third weekend past now slightly higher than the second weekend. And then the weekday trauma has kind of stabilized in this last week a little bit better than the week before. But the long take-home message here is that we know the moment the restrictions were lifted on alcohol, there's been an increase in trauma at the same time as our public sector hospitals were seeing the most COVID cases in their hospitals. This is just a comparison of the trauma in these 17 emergency centers. It's the 3 weeks before the alcohol ban was lifted and the 3 weeks since. So you can see the 3 weekend peaks and the higher baseline. So about 46% increase in trauma patients generally, but the weekend peaks was a 75%.
All right, Western Cape Premier Alan Winde there, giving us an update on the latest with regards to coronavirus and the vaccination program that is currently in progress, and as well as the response mechanisms that the province is adopting.